Welcome to Bronson Children's Hospital. The Children's Hospital is part of the main hospital. The Pediatric Unit and the Pediatric Intensive Care Unit, or PICU, are located on the third floor of the South Campus at Bronson Methodist Hospital. When you approach the double doors to the Children's Hospital wing, you will see a stop sign and a phone on the wall. All of our children's units are locked for the safety of your child. You will need to pick up the white phone to call the unit clerk into the pediatric unit, who will then open the doors. On the pediatric units, we care for children from infancy through 18 years of age and sometimes beyond. In total, we have 44 pediatric beds. 8 of these beds are in our Pediatric Intensive Care Unit, with the remainder being general pediatric and 4 flexible beds. Our care team is made up of pediatric intensivists, pediatric hospitalists, pediatric residents, pharmacists, dietitians, discharge planners, social workers, registered nurses, patient care assistants, and child life specialists. We also offer many other therapies, including music, art, physical, occupational, as well as speech and language. These people and many others provide the best care for your child. Your child will have a team that specializes in taking care of pediatric patients. This includes your nurse and the pediatric doctor, who are available 24 hours a day. They will work together with the entire care team to provide care for your child and you. For some patients, we will have family-centered rounds in which we encourage parents to join. You know your child best and can provide better insight into the proper care for your child. Our patient rooms are set up to make you feel as comfortable as possible. Depending on the age of your child, they will either be in a crib or a bed. We have fold-down couches and recliners so you can spend the night with your child, as well as a small refrigerator for your use. We also have a washer and dryer on the unit and a small kitchen area and break room for you and your family to use. Camp Bronson is the playroom some children may be able to visit. In the playroom, your child can find activities to increase a sense of normalcy. If your child is not able to go to the playroom, activities can be provided for them in their rooms. If your child needs a procedure, such as an IV start, they may be taken to one of the treatment rooms on the floor. This allows the child's assigned room on the floor to be a safe environment away from any uncomfortable procedures, such as IV starts. Our child life, art, and music therapy team will also work with your child to decrease any fears they may have regarding hospitalization and during these procedures. They offer distraction therapy to help support your child. We know having a child in the hospital is very stressful. We pride ourselves in not just caring for our patients, but also making sure the family has everything they need to help care for their child. What is important to kids and families is also important to us here. If your child has a special celebration or milestone while staying at the Children's Hospital, be sure to let us know so we can help you celebrate.
If you follow the compass on the floor to the left of the double door entrance, you will find our Pediatric Intensive Care Unit, or PICU. There's a phone on the wall for you to call the unit clerk and they will open the doors for you. We have a pediatric intensivist on the unit 24 hours a day to address any needs your child may have and are constantly looking over the big and small details to make sure nothing is overlooked. Your bedside nurse is in constant communication with the doctor. Our main goal is to provide your child the best care possible. We know that entering this unit can be very scary and intimidating. The PICU can be a noisy environment. There's a lot of equipment and various alarms and sounds that you may hear. Most parents only see monitors and tubes, so we will help to explain what everything is and its purpose in monitoring your child. All children are placed on a monitor that records their heart rate, breathing rate, and oxygen saturation. Your care team is monitoring these alarms for any changes in your child's status. While we understand that these alarms can be distracting, please do not touch any equipment or turn off any alarms. It is important for your child's care team to know what your child needs. An alarm does not always mean there is something wrong with your child. Sometimes it is just alerting the nurse that something else needs to be done. Your child may have IVs that allow us to provide medications and fluids. They may need additional support with their breathing. If so, we have machines that can assist with that. We want you to focus on your child. The nurses will take care of the monitors and machines. Our team will help you with the best way to support your child. Depending on the situation, some children need the room quiet, while others will need their hands held. Your child's care team will work with you to figure out the best approach to provide your child and you the support you need. Our goal is to provide excellent and timely care when your child is injured, has an illness, or is in need of surgical care. We here at Bronson Children's Hospital believe that the core of our medical practice is taking care of children and their families in their greatest time of need. If you have any questions or would like more information, please ask anyone on your care team. Thank you for choosing Bronson Children's Hospital.